The next speaker is Dr. Vijayakumar, who's a clinical scientist in the Department of Nephrology at CMC. He does a lot of lectures in CMC on chemical safety, so we're very pleased to invite him to talk on chemical hazards in the hospital.
Good morning, everybody. To settle personal scores, or sometimes due to personal disagreement, there are different ways that people do handle. And we read in the press, in the media, that acid being thrown on women is becoming not a very rare, but not too common, but yet we read about it. This leads to disfigurement of the face. One such example is shown here. Could this happen in a hospital? Yes. In the hospital, we also use acids. Where do we use acids? Commonly, we think about laboratories, but cleaning toilets, housekeeping, disinfection, in many such areas, we do use acids. We may not have a major splash like this leading to such major disfiguration, but such splashes could occur in workplace as well. Not a major splash, but even a small drop of acid or alkali falling on the eye could lead to tissue injury, alkali or acid burn, and if it is severe, it could even lead to blindness. And if it's on the face covering both eyes, it could lead to total blindness. A small mistake in handling chemical and just a drop of a strong alkali or acid falling in one eye could result in total blindness within a short period. Thanks to Professor Fleming, I have this slide and the next one to list out the various rules, laws and regulations in India which cover chemicals. This is to underscore this much of emphasis has been given because hazards are associated with chemicals and they have to be handled in a very safe manner. So in this presentation, we will look at what are the chemicals that are being used in the hospitals and in which part of the hospital are they being used. Is it just in laboratories or elsewhere also? And which group of staff are actually exposed to these chemicals and thereby are at risk of having a hazardous outcome. Now, hazards. What are the hazards associated with chemicals? And how do we manage to ensure safety not only for the patient but also for the healthcare worker? Now, how do we get to know about these hazards of chemicals? And how do we permeate that information to all staff in the hospital? And what do we do to protect healthcare workers who work within the hospital from the hazards of chemicals? And what should we do to protect those outside, including the environment, from being affected by the chemicals that we use in our hospital? However careful we may be, incidents do happen, accidents can happen. In that event, what is the protocol that is to be followed? We'll see that with two examples. Now, this list is not an all-inclusive list. It gives some chemicals that are used in the hospital, which is taken from Healthcare Workers Appendix 3. And if you see which location, almost all areas are covered. CSSD, dialysis therapy, food service or engineering, chemicals are being used. Housekeeping, cleaning and disinfection is done in every nook and corner of the hospital where chemicals are being used. In laundry, several chemicals are used, one well-known, bleach. In theatre, in pathology, several reagents including fixatives. But most commonly when we talk about chemicals in hospitals, we think about laboratories and pharmacies. Now, how do they affect? It depends upon whether the exposure is acute or long-term chronic. It also depends upon the concentration of the chemical and the duration of exposure. What was the route of exposure? Was it accidental swallowing, or did the person not wash his hands properly after handling a hazardous chemical? Was there contact with skin with either a spill or a splash? Or was it through inhalation of the mist, dust or fumes? So the route of exposure matters. Most importantly, or equally important, is the physical and the chemical property of the concerned of that particular chemical, and whether it is hazardous on its own, or maybe okay but works in synergy. When it is in combination, it works worse, or maybe synergistically, both combined together, the effect is still more worse. What are the types of hazards? To broadly group them, We can call them as physical hazards of the chemical and the health hazards for the personnel exposed. They may be flammable, they may be corrosive, they may be explosive, or they may be compressed gases. Now, the various other physical factors are being covered elsewhere in a topic. I am focusing only on the chemical properties. So, they could be causing health hazards, like they could be carcinogenic. They could be allergens like powders and gloves. They could be again corrosive or poisonous. So, the first basic rule of chemical safety is know what chemical you are using, know about it, and also know how to protect yourself and others while you handle that chemical. Where do we get all this information? Our quality cell has done a commendable job of putting together the list of all chemicals used in our hospital and the relevant information about each. For each chemical, such information can be obtained from what is called as Material Safety Data Sheet, MSDS. The name has now been revised as Safety Data Sheets, or SDS. This gives the name of the chemical, what are the hazards associated with the chemical. If it's a combination, what is the composition of the reagents or the ingredients? If exposed, what are the first aid measures to be taken? Apart from firefighting, if there is a fire incident and some major chemicals like plenty of formalin is inside that room, what should be done? How could it be accidentally released? How to handle it? How to store it? All of this focus on safety, and do it safely. So how do we manage them in a safer way? One has to have a very clear-cut chemical hygiene plan. As is called, from cradle to graveyard, everything should be having a clear-cut protocol. How do you procure? From whom? And how? When? How much? It's not advisable to collect something or buy something in bulk and store it, which increases the hazard factor in the area of storage. When you receive it, how do you receive it? What you need to check, and how to store it. How to use it, a clear-cut protocol should be given. And what are the personal protective equipment that should be used should be listed out. And if at all exposed, how should that hazard be neutralized? And finally, the remaining, the used or the unused, how should they be disposed so that they do not affect the surrounding environment? All of this should be clearly spelled out in a chemical hygiene plan. So to control the hazard, how do we go, or what is the hierarchy? If you can, avoid using that chemical. Eliminate it from the scene. If not, substitute it for a lesser hazardous material. For instance, in dialysis therapy unit, we replace formalin with a less toxic renalin. Then bring in engineering controls, isolate the place where chemicals are used in bulk or stored in bulk, locate them away from the general high traffic areas, within laboratory or in restricted areas like pathology laboratory and so on, use fume hoods. And as we have fire safety devices, fire alarms, these equipment should also have warning devices to alert of a chemical spill or an increase in the concentration in the atmosphere. Next comes the administrative measures to control. Workplace ethics, workplace and work practice rules should be spelled out clearly. All of this should be available in a standard operating procedure manual. Not only should it be there, every staff should be made aware of what is in it, train them to do it properly, implement these protocols, and monitor if it is being followed properly. And also the personal protective equipment that needs to be used. Now, among this, all of the first four are very effective provided by the institution. But finally, the safety of the worker is additionally ensured by the PPE, which in general is least effective, but in protecting that individual, because it is worker dependent and depends on that worker's practice. Several personal protective equipment to protect the eye, face, respiratory tract, ear, hand and body so that we are not exposed to these chemicals. We know so much about the hazard of a chemical. How do we communicate it to everyone? We prepare a manual. Yes, it would be a very exhaustive 400 or 600 page manual having every information. I could read through it, but when I use it, to what extent would I remember it? the ideal way would be to use labels using appropriate signage. I can write a 4-page article about the toxicity of a chemical, but this one symbol saying danger will make the worker think what the danger is and how to protect myself. The common labels in practice are 2 types. The one of NFPA, the National Fire Protection Agency's label, which is for acute exposure or sudden exposure to larger quantities, and the National Paint and Coating Association's label, also referred to as HMIS, Hazardous Materials Information System, which is for chronic exposure. In all of this, we have these 4 boxes of 4 colors: red for flammability, blue for health hazards, and yellow for reactivity. And the white is to give additional information like whether the chemical is corrosive or carcinogenic. What personal protective equipment should be used? There is a PPE index. So for class C, one should use goggles and gloves and apron. One can remember it. An easier way is to use the label shown on the right top, which gives the detail as well as the PPE are shown there. It could be circled. What we use in our laboratory is the label which is shown below, the name of the chemical, the hazard associated with, and the common PPE that we use in our lab. We strike out the ones which are not applicable to that particular chemical. This way, whether they have had the training or not, whatever their level of education be, including housekeeping staff, by seeing the signage and symbol, they'll be able to be warned that there is a hazard and they would use the appropriate personal protective equipment. Chemicals are stored in cupboards or in various other manners. The most common way to arrange them is in alphabetical order. But when it is chemicals, one has to remember there is an issue of compatibility. The corrosives should be kept separately. The cupboard should have a clear label saying it is corrosive. Flammables should be kept separately. They should not be together. And among the flammables, one may not be compatible with the other, so they should not be stored together. This is a chart for chemical storage. So by this, you can choose the combination. Like for example, a particular chemical shown on the 2nd column versus the 6th column. They can be stored together, but at least 5 centimeter gap should be there. Some can be stored together. If you have less number of chemicals, if you come from a smaller setup where this may not be applicable, what you should do is use a larger plastic container into which you keep the chemical. Thereby you are ensuring secondary containment of that chemical. This is the chemical compatibility chart based on the chemical per se in that reagent. You can choose the compatibility and accordingly store. Store it in an appropriate way that there are no hazards, not only from the chemical per se, but by the accidental combination of the two. Finally, we use some chemicals. The unused are thrown away. Drugs, the expired drugs are thrown away. So we may have chemical waste per se or pharmaceutical waste as such. There should be a clear-cut disposal policy. In our hospital, we do an annual inventory of the chemicals and we make a list of the chemicals that we want to dispose. This is communicated to the office of the General Superintendent, and the GS office communicates it to the company which deals with disposal of these chemicals. They come at a fixed date and time, collect it from us, dispose it and give us a certificate as to how it was disposed and the destruction certificate to say that it was properly treated and disposed without endangering the surrounding environment. So far I have outlined or highlighted some of the measures that we have to keep in mind while handling chemicals. How much ever careful we may be, how much ever our work practice is good, accidents can happen, incidents do happen. With 2 examples, we will see what should be done. An example would be mercury in a BP apparatus. A nurse taking BP for a patient, accidentally the device falls and breaks and there is mercury spill. What should be done? Remember, from the MSDS, we should know mercury is toxic. Mercury on contact with air will produce mercury vapor, so it should not be inhaled, no direct skin contact. This video will show the protocol.
Mercury is hazardous to health. Every laboratory must have a mercury containment kit to deal with a mercury spill. A mercury containment kit must include 2 pairs of gloves, a face mask, a syringe, a pair of protective eyeglasses, 2 stiff pieces of cardboard, 2 plastic bags, a surgical tape, a torch, and a container half filled with water. In case of a mercury spill, the following safety measures must be adopted. Never touch the spilled mercury. Remove any jewelry or watch from your hands and put on the protective gear. Put the broken thermometer or sphygmanometer in a puncture-proof container and store safely. Use a torch to locate the mercury. Do not use a broom or a vacuum cleaner to collect or clean away the mercury. Push the mercury beads together with the cardboard sheets. Then use a syringe to suck the mercury. Carefully release the mercury inside the container of water and seal it. Pick the remaining mercury with the surgical tape. Then place the contaminated tape, syringe, gloves and the cardboard in a plastic bag. Label this bag as mercury waste. Place this bag and the sealed container into another plastic bag. Label this bag also as mercury waste.
Once this hazardous chemical spill has been contained into these covers, in our institution, we are to send it to the Environmental Engineering Department for appropriate detoxification. The other example, or the last example that I would like to show here is a lab worker or a laundry staff working with a liquid disinfectant. At that time, accidentally, some of the fluid splashed onto his face. Here we are considering the eye protection. So what should he do? Now remember the scenario here. When we talk about pollution, we say the only solution to pollution is dilution. Now a chemical has spilled into my eye, and in order to protect my eye, the first thing that I have to do is to dilute it in such a way that I totally remove the chemical. This is done by irrigation. You may use an eye wash station, which is nothing but a sink meant for it, where there are 2 inverted shower cups, and with force of water, where you open your eye and flush your eye or irrigate your eye with the water coming up. Now, if yours is a smaller setup, you can use this type of eye cup, which is available in the ordinary medical shops for a cost of ₹30. We have this in our laboratory. Not the lady, just the cup. So the way to use that is, if there is a spill, we fill it with saline, fix it on the eye, invert, roll, open your eyes, roll it so that there is irrigation. Keep doing this again and again for 10 to 15 minutes. Or you may use a bottle like this, which comes with that eye-shaped edge on one end. You can do it this way by squeezing the bottle. You irrigate your eye with the saline or the fluid in it. Or the other way is to tilt your head and do it. This is better, but you're likely to wet your clothes. So to recap what we have seen so far briefly, the list of chemicals that are used in a hospital are very long, where almost in all places, almost every staff is exposed to a chemical in one way or the other. There are several types of hazards. We should know them, and we should implement appropriate control measures, communicate it to everyone by using appropriate signage. There should be a clear chemical hygiene plan to protect workers within the hospital. There should be a clear chemical disposal policy to protect the environment surrounding us. And in the event of an incident like spills and splashes, there should be a clear protocol. It applies to all fronts. This is seen everywhere. Remember, it is acid which is used. If you are using acids for cleaning, the stronger solution should be used for high traffic areas like OP clinic, toilets and restrooms, whereas in the other areas, a lesser stronger solution should be used, or preferably use less stronger solution, and once in a while use stronger solution when it becomes very, very dirty. If you are using pesticides, preferably go to pyrethroids rather than organophosphates and organochlorines. When dealing with hazardous materials, know your chemicals, be aware, and most importantly, adhere to the protocol. Working safe is a combination of all of these together, and the success of this program is not measured by glory, but by the safety of everyone who comes into that hospital. Chemical hazards are there, they will be there. Our role is to identify them and manage them in a safer way. It's a long topic. to cover in a shorter period. If you need some more additional information on any of these, please feel free to write to either of these email IDs and we'll be happy to respond to it. At this juncture, I thank the organizers for giving me this opportunity and all of you for your patient listening. Thank you, one and all.